We're talking with two doctors now from the Center of Aesthetics and Plastic Surgery in Neenah, and they're here to answer your questions. Earlier this week, we put it out there. We said, you know, any kind of questions that you have, sometimes it's nice to not have to make an appointment and just get firsthand advice from the doctors, and we've got it for you today. So here from the Center for Aesthetics and Plastic Surgery in Neenah, Dr. Todd Vanier, good to see you,
morning,
doctor, and then Dr. Pavel Stahovovitz. Good morning. Good morning.
Good morning.
Hopefully I didn't butcher the name too bad, Dr. Pavel.
It's better this time.
Good, good. Okay, so this is really cool. Our viewers asked some questions, and you guys are here to answer them. And the first question comes to us from Amy of Appleton. She says that she had weight loss surgery about 5 years ago, and she lost over 150 pounds. So you go, girl. Now she's considering cosmetic surgery. She's only 29 years old, and she's hoping to have a child or kids within the next 6 years. Does she have the cosmetic surgery now, or should she wait until she has kids? So who wants to jump in here?
I can do that one.
All right, go for it.
Well, I think the big point to make is that with the weight loss, we have significant body changes.
Sure.
There's a lot typical problem areas: the center, the abdomen, excessive skin. But we also know that with pregnancies, body changes as well. So I think you have to make a decision whenever, if the skin on the abdomen is a big issue, maybe a procedure where we simply reduce the skin, get through the pregnancies, and then come back for the actual abdominoplasty where every fine-tuning is done. I think in some cases the skin overhang is so severe that simply going on for the next 4 or 5 years is impractical.
It's too long, yeah.
But if this minor, maybe waiting is the better option, and ultimately we should see the patient. We can give you that honest advice up front, and you can plan for it.
All right, good advice. All right, next question. If you do have any kind of this surgery, like this woman, and I'm sure you're seeing a lot of this now after all these weight loss surgeries that are so successful, that a lot of them have been. You're seeing this a lot. Do you do that extra skin removal surgery? Where do you do that?
Well, we have a fully accredited center. We have 2 operating rooms.
So right there at your place?
Right at our center. They're functioning as normal hospital operating rooms. The only difference is that this is an outpatient surgery.
And are the results just amazing? First of all, they have the weight loss, and then they get rid of all that extra stuff?
It does require a very structured approach.
Okay.
It frequently requires some additional touch-ups because the elasticity of the skin is different. But the changes are very significant.
I bet. Wow. All right, Dr. Vanier, the next question. This viewer wrote in, I read about a new laser treatment for wrinkles on WebMD. Do you know what it is, and does it work?
Well, yes, I do know what it is, and yes, they do work. There are a lot of different kinds of lasers out there.
Okay.
So one of the important things is to always explain what are your goals with particular laser treatment, and what kind of laser am I going to need to achieve those results. What the hot topic is right now is something called fractional laser, or fractional CO2 laser. The carbon dioxide laser, the CO2 laser, has been around literally for decades. It used to resurface the entire surface of the skin, taking the epithelium, the top layer of the skin, off. Well, that led to wound management issues. It led to a prolonged healing course. It led to a lot of redness for quite some time, although the results could be fantastic. The fractional CO2, the laser energy is generated the same way, but the energy is delivered to the skin in a fractionated pattern, almost like a honeycomb. So we're treating parts of the skin almost on a microscopic level, but leaving parts of the skin behind that are untreated. So in some cases, like with severe acne scarring, we can actually go deeper into the tissue because I'm leaving healthy tissue that's not been treated with the laser behind to heal from. There is a quicker healing with the laser. You can change the energy levels, you can change the pattern, how close these spots are, how far away they are. So if someone wanted to come in for a quick lunchtime peel,
sure,
which we did to our staff a month ago, they all went back to work the same day and all came back to work the next day. You can be more aggressive with this fractional pattern and the energy, and they might take a day or two to recover from. So it's a technology that's been around for a long time with a new way to deliver it, which significantly speeds up healing. You get some fantastic results with it, much less downtime. As you were talking about earlier, we all want a quick fix.
Right.
And, one of the trends in plastic surgery is how can we achieve some of these results without the downtime, without
Sure.
having to go hide for 6 weeks
Right.
before we come back.
Right, because we can't afford to do that.
Right.
Okay, one more question. Can you lose 2 to 3 pant sizes with liposuction? And how long, again, would this person be off work? I mean,
Well, depending what area of the body we're talking about, but certainly if the main problem is a thigh or a hip, certainly a size or 2 is definitely realistic. In some cases, even more. The downtime from liposuction is not significant. That is, we want you to wear some compression garments afterwards. We would like you not to exercise. But I think reasonable expectation is just maybe a few days off from work.
wow, so it's quick
It's
fix.
fairly quick.
All right. Thanks, guys. Really appreciate it. Again, any questions that we didn't get to, call the Center of Aesthetics and Plastic Surgery in Neenah, and they'll be happy to answer them. Good to see you guys.
Great. Thank you,
Thank
Amy.
you.
Thank you.